So welcome everyone, my name's Emma Smith. This is our fifth masterclass workshop, and I'm delighted that we've got Anne-Marie Dickinson with us today, who is going to have a chat with us about hearing and communication. So if it's okay with you, Anne-Marie, I'm going to hand straight over.
Yeah, that's brilliant. Thank you, Emma. So yeah, my name's Anne-Marie and I work at Salford Audiology, and actually we're based in the community, so we're over lots of different gateways there. And I've been doing audiology for a long time, about 20 years. I've done audiology, so hearing tests with children, adults, and actually I really love working with adults, and my job at the moment is to make sure that our services, that what we offer is really suitable for everybody that comes into it. Make sure that we're flexible, make sure we listen to what people need, and make sure that people have a really good experience when they come and see us, that we do everything we can to make it relaxing, comfortable, and stress-free. And that's actually quite difficult, isn't it? Especially at the moment with everything that's going on, to kind of get people to come and feel relaxed. So it's really good to get feedback from you as well, people watching this, about things that we could do in our team and in our service to make it better. So what I'm going to focus on today really is about hearing, and about what we can do in audiology to support hearing, and what you can do together to support communication. So I've got some resources to sort of share, like little videos and websites and things that are really useful, things that I've sort of picked up over the years, and I thought, yeah, this is really good information that everybody should know to help people to hear better and to communicate better. But I know this is a group that specifically focuses on dementia, for people with dementia. So I'm going to start, I'm just going to share, oh, hang on, a figure that I saw recently. This was in a webinar, so there's been loads of webinars at the moment that I've been watching about all sorts of different things. It's been great. And this popped up in one of my webinars, and I thought, oh, this is really interesting. Because actually, when I look at this figure, so can anyone think what this figure might be describing? Don't worry, so it could potentially be describing lots of different things. And actually, it was describing, this was what it was from. So it was a webinar that was talking about dementia, rehabilitation with dementia. But actually, this figure could have been describing hearing loss, because all the different aspects, all the effects of hearing loss are very similar. There's a very big overlap between the effects of hearing loss and the effects of dementia. That makes it difficult to pull them apart, and it means that they're amplified. They can work together and make things much more difficult for people who've got dementia or who've got hearing loss. So, and actually there's loads of like really good information that we know that here, it's not just that you can't hear what's being said or what people are saying, it's also that it can make you feel quite lonely. The fact that you miss out on what's going on around you, you can't join into conversations, and that eventually can make people feel quite sad. They start to withdraw, they don't want to join in with what's going on, so they start to not respond. Maybe they can't hear, maybe they don't want to hear, maybe they know they can't join in even if they do hear. It can lead to a lot of confusion because they haven't heard what's going on around them. They don't know what other people have heard, what other people are talking about. Things are a bit more of a surprise for them. They might have to ask for people to repeat it. And sometimes even if people repeat it, it can be hard. There's different ways of saying it in a different way. And I'm going to talk about good communication as part of this today. And ultimately, people can feel very alone and like they've lost that connection with what's going on around them. And this is an impact of hearing loss, but this is also an impact of dementia as well. So the two combined together can make it a really, really challenging, kind of really hard for people, and for people with dementia, for people that live with people with dementia as well. So this is really difficult, and there's an awful lot of overlap. So I've put the next sort of slide in. I'm not going to talk about it a lot, but there's a really quite famous figure. This sort of S figure is a very famous figure about what are the risk factors that might lead to dementia or could make dementia worse. And hearing loss has been shown to be one of the highest risk factors, especially if hearing loss starts in midlife. So people who may be in their 40s start to get a hearing loss can have a really big impact long term. And then it's also linked to two other factors I put on there: depression, social isolation. So you can see how all these factors can work together to mean that it can have an impact on how somebody feels, on symptoms of dementia. So we don't know whether giving someone a hearing aid prevents dementia. We don't know that yet, but it's certainly not going to make things worse, and it definitely will help somebody to have a better quality of life, to be able to talk to family, friends, join in with things that are going on around them, feel part of what's going on, help them to socialise. That's very clear benefits of having a hearing aid or having support with hearing. So I work in audiology, and we see newborn babies when they're first born. We test them when they're a few days old, right through to 100 very elderly people coming in. People come to us from their doctor. So you might go to your doctor and say that you're having hearing problems, and then your doctor can refer you through to audiology, or sometimes it comes from people that already work at the hospital. And audiology isn't very well known in terms of what we do. And often when I say to somebody I'm an audiologist, they'll say pardon, if they do know what it is, as a joke. That's the standard joke. Or then they might say, what's audiology? What is it? And I think sometimes people think that we just do hearing aids, so that's all we kind of do. And actually there's lots and lots that goes on in audiology. Has anyone been to audiology? You could just stick your hand up if you have. Yeah, no, just one person, great. So in terms of what we do, we do hearing aids, and we do technology, and there's different things that can help you to hear better, different devices, different implants to pick up those sounds that you're missing. But actually we also do a lot of counselling and support, and that could be for hearing loss, or it could be for tinnitus. Has anyone heard of tinnitus? Where you get noises in your ears or your head. It's very, very common, and sometimes it can become very distressing. People feel like they can't get away from the tinnitus, and we can support them and give them strategies to help them with that. And then we also look for medical situations that need some treatment. So we can refer on to the ear, nose and throat department. We can refer on to colleagues that can do different tests, and of course we can remove wax, which is really, really important as well. And I've just made a note about having a hearing loss and a vision impairment. This is really a really important group of people that we want to see in our clinic, because to have both a loss of hearing and a loss of vision, you can imagine how much more isolating that would be for people, especially when that is acquired over time as they've got older. So they might not have the strategies in place. These particular adults are very, very important for us. We want to give them as much support as we can. So you might be thinking, well, what can I do, or how can I help myself with my hearing, or what could I do to support others with their hearing? And there's lots of different things that you can do. And the first thing I've said is about talking to your GP about a referral to audiology. So actually there's lots of guidance that's come out by NICE, who are kind of the big people in health, and they make all these recommendations about what we should be doing in our clinics and who we should be seeing. And they say actually anyone who is got cognitive impairment, dementia, should have a referral to audiology for a hearing test, even if there's no symptoms of a hearing loss, but just so we can rule that out. So that can be looked at first. What's the hearing like? If there's a hearing loss, it can be treated. We can support them with that at the same time that maybe they're having their other assessments for their memory and things like that. So this is a really big change, and actually it's been in place for a couple of years, but it hasn't quite come through yet with GPs, and that's something I want to work on, to really promote this idea that anybody with any type of memory impairment or cognitive impairment will come and have a test. And then after that, we want to then see them every 2 years as well. So we want to make sure we see everybody. And we don't do this for everybody, but we want to make sure that we see anybody who has dementia every 2 years in the clinic. So we can do a really good check of what their hearing is, make sure if they've got hearing aids that they're perfect, make sure that they're fully supported. And then you might also want to have your ears checked for wax quite often as well, because wax can build up, it's very common, but it can stop you from hearing as well. And even just taking that edge off your hearing can sometimes have a really big effect on you. You feel like you can manage okay, you can lip read, but then when your ears fill up with wax, that just makes it much more difficult to manage. And also it can be that the wax can be quite itchy and it can become a bit painful. And sometimes there can be things behind the wax that we're not aware of. There might be an ear infection behind there, but it's harder to see and it's harder to treat. So getting your ears checked regularly for wax is a really good idea as well. And then in terms of hearing aids, if there is the option to have hearing aids, then it's about this kind of positive attitude to hearing aids, because often people think, oh, hearing aids, oh, I don't want them, they're too big, they're too hard, they're too fiddly. And there is an awful lot of negatives about hearing aids, because they are fiddly, they can be fiddly to fit. I've actually got one here. Well, I've got two different types that I'm going to show you that are the most common ones that we do. So the first one is a hearing aid which is on an ear mold. Can everybody see that? So I've got a glittery ear mold here, and then I've got the hearing aid behind it. This ear mold is made to the shape of your ear, so it's a perfect fit, if you like, because we take the shape of the ear and we make the ear mold. So it's a really good fit in your ear. It's fairly straightforward to get in because it's quite easy to hold. It slots into place where it should fit in the ear. And then once it's in, it's quite secure, it's not coming out, nothing's going to pull that out, and then it goes over the top of the ear and it sits behind the ear like that. So that's one type of hearing aid we've got, but we've also got another type that we use quite often now, which looks like it's got this little tube attached onto it here. And this is called, well, it's called a thin tube fitting, but this isn't measured particularly to anyone's ear. We've got different size tubes, we've got different size bits that go on the end, domes. And these are very lightweight. It goes over your ear first so that it can lean on there, because it's quite heavy compared to the earpiece. And then the earpiece goes into your ear. Now these ones are nice because they are light and they're much harder to see, so people like them because they're quite discreet, and because they're quite open, they let a lot of your natural hearing. So if you've got quite good hearing, you can still hear things using your natural hearing with the hearing aid in place as well. So there's lots of different benefits and pros and cons of having one like that, or perhaps one like that with the ear mold. But whichever type you get, they take an awful lot of getting used to and an awful lot of practice with, because initially things just sound really strange. So you'll pick up noises that you've not heard before, things like people come in and say, my car is so noisy. When I do my indicator, it's so noisy. And it's not because it's too noisy, it's always been that noisy, but you might not have heard that particular sound before. Or people will say, oh, I was running the tap and it sounded like Niagara Falls. Or they say, I was having a wee and it was just so noisy. There's all these sounds that will come through the hearing aids that will give you a bit of a shock to start with. And that's totally normal, because what happens is your brain has got to get used to all those noises. So if you imagine, a hearing loss usually happens very gradually. Your hearing will go down very gradually over a few years. Suddenly the hearing aid goes whoosh, and gives you all that noise back again. And your brain just takes a while to catch up with it, and it has to have a good chance to get used to it and to think about what the noises are. You might need to have a little walk around your house in the hearing aids, make different sounds around the house and see what everything sounds like. And if you go for a walk, it might be good to go for a walk with somebody else and say, I can hear a funny noise over there, what's that? And they might say, oh yeah, that's just the dog that barks on the next street. But because you've not heard it before, you just need somebody to kind of help you to work out what those sounds are. And once you've done that, then your brain is really clever and it will just switch off to those noises. You won't hear them. You'll just forget about them because you know that they're not important. And then you can really focus on what is important, what you want to hear, what people are saying to you, what's on the telly, who's at the door, who's on the phone, those types of things. But it takes a while, probably takes about 6 weeks, which is a long, long time.
Joy, do you want to say something?
Yeah, before I forget, do we have to pay for these hearing aids?
No, they're all free on the NHS. You have all the hearing tests, all the support, the hearing aids are all free.
Okay.
The batteries are free as well. So the batteries come in these little packs here and you can pick them up from a gateway centre, any gateway centre. There's different sizes and different colours and you can buy them, but we always say don't buy them because they're free from us and you can get as many as you need.
I didn't know about the two. I didn't know that if you're living with dementia, then you really want people to come in every 2 years, which makes absolute sense. But I didn't know about that.
Well, it is quite new and it's not something we've ever offered before, but now that we're starting to change our services, we definitely want to do it. So I'm going to have a little monitoring list, so I'll know who needs to come in every 2 years and I'll be able to call them in. But while we set that up, it might be that you could have a chat with your audiologist, and so they might fit your hearing aids and then they might say, oh, that's it now, you contact us if you need anything. And actually at that point they should say, we're going to put you on a little list now and we're going to contact you again in 2 years. But if they don't, because these things take a little bit of time, then you could say, oh, I'd like to come back in 2 years and have a hearing test, and then we can arrange that for you. It's just good to keep a really close eye on what's happening with the hearing, because it's quite hard to express hearing problems in terms of, or to notice them yourself. So people, sometimes it takes people about 10 years before they go and get help for their hearing problems. And it's because they don't notice them. They think it's normal what they can hear. They don't notice the changes. And often it's other people that notice it. So family might say, oh, you're not hearing me, you can't hear that. But the person themselves might think, oh, that's because they mumble, and that's because they're talking in the kitchen, and that's because they've got their hand over their mouth. And sometimes it is those things. Those things make a really big difference. But sometimes it's because there is this hearing problem there as well. It takes a bit of time to acknowledge really that it's there. And often there's a bit of a stigma with hearing aids. People think, I don't really want a hearing aid, it's going to make me feel old, just like people don't want a stick. And actually that's why we've gone for these sort of silvery ones, because we're trying to make them seem a bit more high tech. You know, you used to get these beige ones that were skin coloured and they were a bit ugly really. And we hope that these ones are a bit more modern. You know, they could be something that attaches to your phone, and actually you can, using a streamer, you can attach your hearing aid to your phone and have a conversation with your hearing aid in as a hands-free kit. So we're trying to make them look a bit more modern, a bit more snazzy. There's different types of ear molds. So you can see I've got a sparkly ear mold. I had a lady that came to get some red sparkly ear mold yesterday for Christmas. So yeah, you can have lots and lots of fun with different types of ear molds. So, and that's why I put those words on the slide about encouraging each other to use the hearing aids, persevering, using them every day. Even if you think, oh, I'm not sure these are helping, why am I picking up that dog next door? Or just keeping going with it, and actually thinking about how important the hearing aid is to help you to link in with what's going on around you. Going back to those first few slides, help you to feel connected, help you to talk to people, help you to be involved in what's going on. And I've put a few ideas there in terms of like checking that the hearing aid's working, because the last thing you want is this in your ear that's not working, because it's just going to block your hearing, make it even worse. So you want to make sure it's working. So one thing that you can do is to just check that the battery's working. So the batteries are always in the bottom of the hearing aid, and there's a little lip at the bottom. This is nice and big, and you clip it open like that, and then the battery sits in there. And the batteries need changing about once a week, but actually sometimes they might need it more often. So say it's been left on overnight, when you close the door like that, the hearing aid is on. So if it's accidentally left on, then the battery will go down in a couple of days. And when you're wearing the hearing aid, you'll get a beeping noise to tell you that the battery is running out. It will beep, 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 beep to tell you. Tubing. So if you can see here, there's an ear mold, there's a piece of tube, and then there's a hearing aid. this tube carries the sound into your ear. So if it gets blocked with wax, or if it gets filled with, sometimes it gets a bit damp with sweat or anything like that, it actually stops the hearing aid from working at all. So you can take it apart, they twist off, and you can give it a little shake to check if anything's in it. And then this tube here can be replaced. So we can do it for you. You can make an appointment, come to any gateway. You don't have to come yourself, someone else can bring it for you and we'll change the tubing. And we recommend that happens about every 4 to 6 months anyway, just to check that everything's looking good with your hearing aid.
So you can't wash them?
You can take them apart, and then this bit can be completely washed. That's fine. You just have to be really careful that there isn't any water that stays in the tube or any soap or anything. So give it a really good shake out, leave it to dry separate before you put the hearing aid back on again, just to make sure there's no water that's going to affect it. And actually, there's some really good videos online about how to do this. So this is what I might share that with you now. Let me see whether that might actually be the next slide. And these videos have been great when our clinics haven't been as open or as available. This is the website here. It's called C2 Here. And it's got lots of videos on it. Has anyone heard of it before?
No.
No, it's got really good videos about how to put tubing in, about how to get used to hearing aids, different tips about how to communicate really well. It's really, really good. Let me stop this sharing the slides and I'll actually show you the website. Just bear with me a minute.
I was wondering a bit about if you've got increased sensitivity because of your dementia to certain noises, and then you have a hearing aid. Have you any thoughts on that? Is it something you've just got to get used to? I'm thinking about you, Joy, because I know some noises for you are like massively sensitive, like a door banging or a siren. And if you've got a hearing aid, does that mean it's even more sensitive, or is that something you've just got to train your brain to get used to, Anne-Marie?
There's all sorts of different settings that we can have on the hearing aid, and there's all sorts of different ways that the hearing aid tries to stop the sound being too loud. It's called compression, and it squashes the loud noises down to make them more comfortable. And we can make that stronger if people are very sensitive to certain noises. We can have a volume control on there so that you can turn it up or down a little bit yourself as well. So if you do feel sensitive to any noises, it's a really good idea to go back and talk to your audiologist, and it's a really good idea to keep a record of the noises that you feel sensitive to. Write them down, and that will help us to know what types of sounds need to be turned down, what pitches, how much to turn them down by, that type of thing. Keeping a little diary is actually a really good way to come back to us to report problems, because it means that it gives us a lot of information to work from.
It's actually quite a benefit then if you've got a slight hearing loss, and you can, some of those noises that you do have an increased sensitivity for, if you've got a hearing aid, actually it's going to bring that down. So that feels pretty good.
Potentially, yeah, because hearing aids also have this like maximum power output. They don't go above that. So even if an ambulance went past or anything that was loud, they would never go above a certain level, which you're right, without the hearing aid, the sounds can go above that level. So yeah, that's true. And it might be that some situations, if it's very noisy, I'm trying to think of where that might be, but sometimes it might be the best thing to do is to take the hearing aid out in certain situations. And if you can plan ahead and you know that's going to be the case, then it's easier. You'll tell whoever that you're with that you're going to take it out. And so it could be you're watching a band, or you're somewhere where there's music on. Live music is a typical one. People would just rather take it out and turn it off. Could be when you're on the bus, if the engine noise is very loud. But hearing aids have lots, and they're really, even though there's a lot of limitations to them, they're actually very clever little computers that are doing all sorts of calculations all the time. They're trying to work out what the background noise is, what you want to hear, what the speech is, turn the speech up, turn the background noise down. If it's a loud noise, they try and turn that down. If it's a soft noise, they try and turn that up. And that's going on all the time without you pressing anything. That just happens. But actually, because our ears are so amazing that the technology isn't there yet, that it's like our normal hearing, even though there's so much research going on and there's all these hearing aid companies trying to develop the next big sort of hearing aid feature that's going to help in background noise, there's still a lot of limitations with them. And that's why really good communication, how you talk to each other, is really vital, even with the hearing aids in. Can you all see the website, the C2 Hear website? So you can see here that there's information for family and public, information for patients. If I click on the information for patients, the first thing it'll do is ask you what type of hearing aid you've got. So just as I showed you, it'll say, do you have a mold or do you have an open fit? And you can pick the one that's suitable for you. So let's go on custom ear mold. And then it'll say, have lots of different options about getting to know your hearing aid, how to put it in, can be a tricky one, how to retube there. So it'll do a little video. And it's been developed by the University.
A step-by-step guide to retubing your ear mold. Having watched this video,
so I don't know whether I shared the sound there, but oh, is it great? Okay.
You will know how to change the tubing yourself. Tubing replacement. It is important to replace the ear mold tubing about every 6 months to prevent problems arising. If at any time the tubing comes out of the ear mold or goes hard or yellow, it needs to be replaced. Put a twice yearly reminder on your calendar to make an appointment at the audiology.
And this is all information that we will give you at the appointment, but actually sometimes we give you so much information, I think it's hard to take it all in, and actually having it in a written format isn't always the easiest way to remember it either. So having it on a video like this is a perfect way to just go through it step by step, you know, like YouTube videos, you're learning something new, you can look through how they do it and kind of work out that to do yourself at home. So this website's been really useful during the pandemic, and they have had 3 million hits now. I think it's absolutely been extremely useful for people. So I definitely recommend this as a way to get some information about hearing and as a way to look after your hearing aids. I'm just going to share the PowerPoint again now. Can everyone see this PowerPoint again now?
Yeah.
Super. So we've talked a bit about hearing aids. They're great, they're useful, they're going to pick up the sounds that you need, but they're not perfect. They're not perfect when there's background noise. They're not perfect when the person you're trying to listen to is a long way away, because by the time their voice gets to your hearing aids, it's not a very good signal. It's just a little microphone at the top of your ear trying to pick it up. So there's lots of other things that we can do to make communication a lot better, a lot easier for you, for the person listening and for the person communicating. So I didn't know whether anyone had any ideas of what you could do. What do you think what's good? Putting everyone on the spot, aren't I?
We'd always say face to face. So if you're talking so that the other person can see you, they can see that you're talking, they can see that you're talking to them, and then they can look at your expressions as well and what's going on for you. So face to face is always good.
That's a huge one.
Yeah,
So,
and your ears point that way as well, don't they? So
yeah,
you're
definitely.
made to talk face to face.
Yeah, makes it much easier. It's much easier to lip read normally, although now with the masks that's been taken away, makes it much harder. We've had a lot of our patients have really been struggling at the moment. It's been really difficult for them. So
You can get clear ones now, can't you?
You can, and we're not allowed to use them in the clinic, which is really sad because they've not been approved by the trust to be safe enough for us to use. So we still have to use where our faces are covered, and it's very difficult. And I think we'd love to be able to use the clear ones because they are much better. But it's a great way for when you're out and about to have clear ones, and you can make them yourself. I could send you some instructions actually about how to make them yourself, or you can buy them, and that can make it a lot better. Have you got clear ones?
No, I have a black one myself. I've just seen them, and for people who rely on lip reading, I would have thought it's a necessity, you know.
Yeah, definitely. But it's difficult for that person, isn't it? Because they need everyone else to have them. So they don't need it themselves, but they need everybody else to have a clear one.
Well, it's people they live with, I suppose.
Yes, yeah, that's right. Or people that family and friends would have them. Places where they go regularly, yeah, definitely. So the charity called Royal National Institute for the Deaf, which used to be called Action on Hearing Loss, and it's just changed its name recently, does lots of really good promotion about communication, how to communicate properly. And actually there's loads of different things we can do, which are on this slide. Ask the person if they've got a hearing aid, ask them if they want to lip read, make sure you get their attention before you talk, turn to face the person that you're talking to, speak clearly but use normal lip patterns so they can follow what you're saying, get to the point, try not to waffle, don't cover your mouth when you're speaking, that has a huge difference. Just check every now and again that what you're saying is being understood. So you just say, is that okay? Or give them a chance to sort of acknowledge that they have understood it. If somebody doesn't understand what you're saying, try to say it in a different way. So you might say, we're going out for tea later. Do you want to go out for tea later? Although you wouldn't be saying that at the moment very often. And the person might not get it. So you might have to rethink about the way that you're saying it. So you might say, what should we have for dinner later? For dinner, do you want to go out for dinner? Or tea, do you want to go out for tea? So you're using different words. You're not just saying the same thing again. You're actually using different words. Or you might change what you say to less of an open question. So you might say, do you want to go to the pub later for tea, or do you want to go to the Italian restaurant for tea? So you're giving them a bit more indications of what you're asking them. And that can just make it a lot easier, because often it's kind of the exact words that aren't being heard very well. So changing what you say can make it better. It's always good not to shout, because once you shout, it changes your lip patterns and it changes your voice and it makes it more difficult. And I quite like this one that says, for longer chats, find a place to talk with good lighting, away from noise and distraction. So this is like planning ahead of it. This is thinking, right, I want to have a chat with you about something now. So where's a good place to have a chat? In the car, that's not a good place. In the supermarket, that's not a good place. When you're tired at night just before bed, that's probably not a good place, because hearing loss can make you very tired. So you might be thinking, right, where would be a good place for us? When and where is a good place for us to have a chat? And that's a really useful tip for if you're living with somebody who's got a hearing loss, that you plan a bit ahead when is a good time to have a chat and when isn't, because everybody needs to relax, and it might be that at certain times, you know, people just need to relax and a chat isn't the right thing, or if it's very noisy, it might be difficult.
In the adverts.
in the what, sorry?
In the adverts.
In the adverts, yes, that's a good time. Turn the adverts down, because they're always very loud. Look at each other, face each other, put the TV on mute, and then ask your question. Do you want a cup of tea and do you want a biscuit? That's going to be a much easier conversation than doing it with the telly on, looking at the telly with it blasting. Otherwise, you'd have to say it 3 times probably with the telly on, looking the wrong way. If you stop, look at each other, you say it once and it's done. It eases a lot of frustration.
I'm convinced they actually turn the adverts up in volume.
Yeah.
I'm absolutely sure they do.
Yeah, and it's a real bugbear for lots of people that come into our clinic. And I think what they do is they alter, like to do with this compression that I talked about, they make it so that there's less compression on it, so it appears louder. It's part of like trying to get the message, the marketing advert across to you. So you're right, it does appear louder, yeah. But they do it in a way that isn't actually increasing the volume. But yes, it is very difficult.
Oh, I see. I didn't know that.
I found it interesting that you said about, so if you've got hearing loss, then you will be more tired, and I guess that's just the effort that you're spending trying to hear and decipher what's being said. And that's again very similar to people living with dementia, that just that extra effort is going to be really tiring for you.
Yeah, definitely. So a lot of people that have a hearing loss find that by the end of the day, in the evening, they just want to take the hearing aids out, they want to relax at home, and that isn't a good time for them to communicate. They just want that bit of peace and quiet. And that's something that if you discuss it beforehand and everybody in the house knows that, that can be, you know, that's part of their day, and that's kind of acknowledging that it is tiring for them. So yeah, definitely, especially if it's been a busy day, they've been out and about doing lots of different things, talking to new people, maybe they've been to the hospital for an appointment, that will be much more tiring. And actually the next slide is about
sorry, Anne-Marie, Joy just wants to ask something.
yeah, sorry, yeah, Joy.
Sorry, I'm interrupting.
No.
I don't know the first thing about hearing aids, only in my caring role. Would a hearing aid, if I was having a hearing aid, would I be able to hear myself louder? The reason I'm asking is because my carer keeps saying, oh, you're not speaking loud enough, I can't understand you, and all this, you know, you're mumbling, and, you know, why are you talking so quietly? So if a hearing aid would help me to know the volume that I was using, is that, I don't know what I'm trying to say really, but
you definitely would pick up your own voice differently, Joy, so you'd hear it through the hearing aids. And people sometimes do change the way they talk a little bit. Often it's people talk lower though, because they are talking quite loud, they don't hear their own voice, they don't realise they're talking loud. When the hearing aids are in, they suddenly hear that, they can pick it up and they talk a little bit lower. But it could change the way that you hear your own voice, yeah.
It did make me, sorry, I was going to say it made me think that the problem might not be with Joy, but it might be with Tony's hearing, because what you've just said was just exactly what Anne-Marie had said, that it's a bit mumbly, you can't, you know, like all of those things. It was almost like that list of, if you have got a hearing problem, you've almost just read it out, and maybe it's Tony who might need to get his ears looked at.
Yeah, good idea, Emma, good idea, yeah.
we'll go together.
Yeah, we get lots of husbands and wives that decide to come together, lots of partners. They make that decision together, they both realise that they want to do something about it, and they come in together. Yeah, that's a really good way to do it, because then you get the hearing aids at the same time. Often you get used to them together, get used to the controls, the batteries, fitting them. It's a bit of support, it's like a joint team support, and that's really useful.
Thank you.
So then I had a look about, actually, when you're communicating with a person who's living with dementia, what do you have to do differently? As you were saying, Emma, there's a lot of overlap between it. And it was really interesting that actually a lot of the points were very, very similar to what we've just talked about. Get their attention, state your message clearly. And actually, I think some things here, maintain your humour, that's a really important one, because it can be very, very upsetting for somebody who's got a hearing loss if they're constantly struggling. So just being really positive, being really kind about it, and keeping going to get your message across. You know, the worst thing is when somebody says, oh, it doesn't matter, to the person who's got a hearing loss. That's an awful, awful situation for that person to be in, because for them it does matter, it is really important. And all being involved in everything that's going on around, all the conversations and hearing everything is important. So I think it's, again, it just shows the kind of effects of dementia, the effects of hearing loss. There's a lot of overlap between them. So good communication for hearing can be good communication for dementia as well. So it's really important.
We're being encouraged to sing, to use singing as a method of communication.
Yeah.
You know, rather than just talking. Do you want a cup of tea?
Oh, yeah. That's a really nice way to do it. And then you can imagine if you did that in a similar type of song for different things around the house. Do you want a cup of tea, or should we go for a walk? That would help the person to prompt them with a bit of a melody as to what you were saying, and support the communication and make it more fun. That sounds really nice. Really
Life's
nice.
an opera.
Yeah. Yeah, it could be, couldn't it? You could definitely could be an opera. So there's another sort of really good resource that I wanted to show you, which is the IDA Institute. It's a website. It's a I describe it as it does a lot of research, and it's very much focused on hearing and communication, but not from the aspect of hearing aids, rather from the aspect of communication strategies, communication partners, how people kind of talk to each other. And they've got loads of really good resources, and there's one, you know, I've put down this video here. I'm not going to play it actually because it's about 10 minutes and we don't have that much longer, but it shows a story between Jill and John. Jill's had a hearing loss for a long time. She doesn't get on well with hearing aids, so she relies on lip reading and good communication. And it's about their life together and how John supports Jill. Sometimes he supports her very well. He has an extra pair of ears when they're out and about in social situations. He fills in the gaps of things that she misses. But sometimes he finds it, he has to repeat himself, and he finds it very irritating. And it kind of shows the real life complexities of having a hearing loss in a relationship, and how it affects relationships, and how from John's point of view, he gets frustrated and he has to work harder in order to communicate. But from Jill's point of view, she needs that support. You know, this isn't her fault, this is part of being in a partnership together. So I definitely there's loads of really lovely videos on here about understanding the effects of hearing loss, how it affects people, and things that you can do, sort of strategies you can do. So I'm just going to move on, because I'm just going to go through some of the themes. Is that actually Jill and John really work together. They kind of work together in different hearing situations. He supports her to help her to hear better, and she that's really essential for her in order for her to and there's a few things that's actually really sad, because in it Jill says, and John agrees, that often when they're having a conversation with somebody, that person will just ignore Jill because she's harder to talk to, and they'll just go and stand next to John and have a conversation instead.
Love that.
Yeah, and that's really because often people feel that they don't know how to communicate. They don't know what the tactics are, and even if they do, because it's a modified way to communicate, they're not comfortable to do it. They won't step out of their normal approach and do something different, face the person, talk one at a time, tell them what they're going to talk about. Often people just aren't prepared to do it. And I think that's part of sort of deaf awareness, being aware of what it's like for people, having a bit of training or developing strategies. So sometimes in our job, what we will do is we'll be giving somebody a hearing aid, and we'll be talking through the family about communication and about being deaf aware and about how they can support that person, and then they can share that with friends and family and hopefully develop that understanding for all the people that person has to communicate with on a regular basis. So if somebody is struggling to communicate like that with you, then it could be worth kind of talking them through what you need or what they can do to help, giving them some tips and advice, and really trying to get them to understand the situation. And then another thing that was interesting in the video is that Jill said that because she doesn't often understand what's happening around her, she's worried that she'll say the wrong thing, which she has done before. Then she feels rude for saying the wrong thing, for getting it wrong. She'd rather not say anything at all. She just decides, I'm not going to say anything in this situation because I find it so hard. And that's where the isolation comes in. Even though you're with a group of people, you're not prepared to contribute, you're not prepared to talk because you don't feel confident with what's going on. You start to feel more and more isolated. But if the people in that group were able to check her understanding every now and again, make sure they were looking at her, make sure they didn't swap topics very drastically. Say you're around the dinner table and you kind of say, oh, we're going to talk about Christmas now, Mum, is that all right? And you have a conversation about Christmas, and then you might say, I'm just going to talk about work now, I'm going to tell you what's happening at work. And just having that prompt can make a huge impact on how somebody can follow that conversation. And then Jill also talks about feeling lost. She says she feels completely lost in a social situation and she just wants to go home. And again, I think this could be very, for people living with dementia, this is kind of a really difficult kind of situation as well.
I was thinking as you were saying that list, Anne-Marie, you could just take out hearing loss and put dementia in there and it would be exactly the same. And I could see Joy sort of nodding and smiling, and I thought, yeah.
The parallel is just amazing.
That makes,
Sorry.
I was going to say, that made me think that if you have some hearing loss and dementia, then that's just times by what, I don't know, 100, 1,000, how the impact of all of that.
Exactly.
You just go and jump under a bus. Yeah.
Well, I think the thing that what we want to do is to manage those symptoms of hearing loss, because hearing loss can be managed with hearing aids that you wear all the time, with communication strategies. Audiology is here because we want to help you manage that hearing loss symptoms. So if the symptoms of, if all this is happening and it's very bad, but the hearing loss gets managed, it becomes less, and then it's easier to manage, it's easier to cope with. There isn't a need for people to live in this situation who've got dementia and hearing loss, because the hearing loss could be treated, managed, and it would make things a lot easier potentially. But often it's overlooked because people will say, have they got a hearing loss? Oh no, they've got dementia. It isn't checked for, and that's why the GPs really want us to check it. We want to check it. We want to check at the first step, is there a hearing loss there? Treat that, manage it, make sure that what happened, that people can feel involved and don't feel left out because of the hearing loss. And it's not easy, it's a long process to really manage hearing loss, but that's what audiology want to do. We're there to support you with it. It's not just one appointment, you don't just come and see us and it's all fixed. It takes a while. We have to do different approaches, try out different things. And we're always happy to see you, to review you, to see how things are going.
So are you hoping that this will be rolled out nationally?
For the testing every 2 years?
Yeah, and just the connection between GPs and them being more aware that the service is available.
Yeah, I mean, it is in this guideline, this NICE guidelines, and that's what GPs follow. So in theory, the recommendation is already there. It's just making sure that GPs know that we're ready for that. Where we've got systems in place, we've got clinics ready, and we're ready to do that. Lots of other services around the country are already doing it. I think the last few years, probably the last 5 years, there's been an unbelievable awareness, like we've just talked about today, about the overlap between hearing dementia. The fact that we as hearing professionals need to be really engaged and really prepared to look after everybody, and to make sure we test hearing and to make sure we manage the hearing loss so that we can try and help people lead a better quality of life. So there's lots of clinics across the country now set up. As I say, I'm setting one up in Salford, talking to GPs all the time, trying to make sure that there is that good link there, making sure we've got a monitoring system to monitor people every 2 years. So yeah, Joy, I hope it will be. I think another 3 years from now, and I think it will be.
As someone living with dementia, I feel there should be a one-stop shop, somewhere that you can go, because eyes are affected, and it's more recognised that the eyesight is linked to some of the dementia stuff. And gums, they're doing a big research about gums and dementia. If we had a one-stop shop where we could go and have them all checked out, say keep going to this department and that department.
Yeah, I mean, that's a really good idea. I have started to link in with services in the trust, like the memory assessment and treatment service, MATS, to see whether, as people were going through that service, we could come and do a hearing test at that point. A lot of eye tests are often done on the high street, outside of hospital potentially. But yeah, I mean, that's the big thing, isn't it, in the NHS, getting services to talk to each other, to work together. It's not easy, actually. People do tend to work quite separately, even in the same trust. There's you'd have to have a lot of cooperation with rooms, resources, equipment, timings, clinics. And that doesn't mean we shouldn't do it. That just means it's going to take a while to get set up. And I would hope that as time goes on, that Salford and the NHS does look to have better access to services. But suggestions like that, Joy, are really good to feed back to the trust. because it might be something that I think about ears, I think about ears, I think about what's happening in the brain, communication. I don't often always see the bigger picture. I try to think about what's happening with my patients in all the other areas of their lives. But patients themselves, you guys, people that are living with these conditions, you see it, you understand it. It's good for you to tell us about it so that we can try to do things better. So any feedback you've got based on today, anything like that, Joy, where you think, why don't we have these different things going on together, please let us know, and then it's something that we can work on to try and improve services.
Like you said, if we had all those, sight and gums and stuff, all evaluated at the point of the memory clinic or at point of diagnosis, then that would be the thing to go on, so that if we had it in 2 years' time, we'd have something right from the beginning that would be our benchmark.
Mm-hmm.
Yeah, that makes a lot of sense to me.
Yeah.
Rather than waiting till 5 years down the line and then saying, oh gosh, I've lost 4 teeth or something. I'm speaking personally.
Mm-hmm.
If it had been checked right at that beginning point.
Mm-hmm. Yeah,
I suppose
definitely.
it's that holistic approach to something, isn't it? And not just going, oh yeah, you've got dementia. There we go. Off you go. No, you've got dementia, so that might. Let's look at your hearing. Let's look at your eyesight. Let's look at your gum health, and just seeing the whole. Let's look at your diet. Let's look at your speech. Like bringing everything together and seeing that person as a whole.
Right from an early stage as well. And there's more and more people like me within the Salford NHS and different NHS trusts where we specialise in adults living with dementia. So there's no reason why we can't all work together now. I'm finding contacts all the time that work in different areas. And it means that we've got the time to work together, to get the plans in place, to set things like this up. So hopefully services will look very, very different, Joy, in 5 or 10 years' time. But the NHS is such a huge machine. It's so slow moving. It's really hard to get things like that. That doesn't mean we shouldn't do it. It just means it might take time. But yeah, I'll definitely take that on board, Joy, and think about how we could provide the hearing test along with other things, other areas of care.
All singing from the same song sheet.
There's a lot of musical theme coming from Paul today. I'm conscious that we've got another 3 minutes of this masterclass. Anne-Marie, I didn't know if you wanted to say anything else or use the last 3 minutes for questions.
Yeah, I think it'd be really good to have a chat if anyone's got any questions or.
I find it.
Taken up too much time.
No, not at all. The questions is a really important part.
I was surprised that you're saying that they're free of charge. Free of charge to whom? Everyone?
Everybody. It is surprising actually, because you have to pay for glasses. But hearing aids, I think it's related to veterans in the war that needed hearing aids. It's something to do with that, a long-standing agreement that hearing aids are always free to anybody. They are on loan. If you lose them, there'd be a charge to get a replacement pair. But initially, at the point of giving it to you, the hearing aids are free for everybody.
All right. Because they advertise on the radio that they're small, but not as small as our monthly contribution. They cost so much that you have to pay for them every month.
You can go privately. There are private hearing aid companies and dispensers, and they would fit. You can see from these that I've shown you today, we're quite limited in the options we've got available. We've got an ear mold, we've got a thin tube. Some people might want ones that go completely in the canal. Some people might want hearing aids that connect up directly to their mobile phone. People have different wants, and often it's around size. If you want a really small one that's invisible or in your canal, we can't give you that on the NHS because they just cost too much. They break too often. It's not feasible. But these are good digital hearing aids. If you were to buy them, they'd be £1,000 each. They're really good hearing aids, and they're fitted to a high standard. You've got follow-up care, really good follow-up care, and it is all free. And it can make such an impact on so many areas of your life to try hearing aids. And the sooner you try them, the better it is, because you get used to them sooner, get used to how to fit them, how they work, your brain adapts, you can get much more from them. Early uptake of hearing aids is something that we're really trying to encourage. Even if you've got a mild hearing loss, get used to the hearing aids, get them on, keep your brain healthy, keep your brain active, keep the signal going in, keep stimulated. That's a really big message that we're trying to get across.
I find it hard to see £1,000 in such a small piece of technology when, you know, you can buy an iPhone for the same price, and what they've got going on inside there is nobody's business, isn't it? You know,
Yeah.
and even the iPods are really brilliant pieces of, you know, the things you stick in your ear. You can virtually talk to a foreigner with them, can't you? You say something and they hear it in their language.
Yeah, really clever. And all that's going to be within hearing aids, and you can buy that within hearing aids now, but they just cost an awful lot more. But as I said, they're like little computers, little tiny computers that are making millions of calculations all the time about the sound that's going in, processing it in the best way they can so that you can hear the best possible way. And that's why we can make so many adjustments to them. And that's why if you're not happy, you should always go back to your audiologist, always go back and say if you're not happy, because there's so many things we can do.
Yeah. The other thing, just one thing, is do we need to go through our doctor to come to see you?
Yeah, it is. We only accept GP referrals. So talk to your doctor. I've actually sent a little checklist to Emma that she might be able to share, just things to look out for that might indicate that either your ears aren't as healthy as they could be or that there's a hearing loss. And it's then mention it to your doctor and then they can refer you on to audiology.
Yeah. And one time in my life, I did come across a hearing dog, which surprised me.
Yeah,
I thought the fellow was blind, to be honest, until he explained that he wasn't. And the dog was there to hear for him after he nearly got knocked down by a tram in Manchester. You know.
Oh dear. Yeah,
his
the hearing
family.
dog. Yeah, the hearing dog can be really good. Again, if hearing aids have limitations, as the hearing loss gets more severe, a dog can just alert people to what's going on around them, and they're a really nice companion as well.
Yeah, I can understand that.
I'm just looking at the time, and you know, it's my job to be the